Thank you so much. Thank you all for being here today. And I assume you guys can hear me in the back? Great. Okay. I want to thank the British Acupuncture Council for having me here today. I made it all the way from the west coast of the U.S., so didn't know if I was going to make it. It was planes, trains, taxis, tubes, but it all worked out. And I'm here in my ancestral homeland. I actually have a lot of ancestry in England, and I could really feel it walking right off of the plane. And I've been trying to eat lots of chips and hopefully get some English lager later tonight. So, like he said, I have a general family practice in Salem, Oregon, and through the years, I've been finding that people are coming in with different pathology, different organ patterns, channel deficiency, that all related to emotional trauma. And through studying with different teachers, working with research in my clinic, I found protocols that really work and really help people transform and walk through the dark night of the soul, we say. So I feel very honored and very grateful to witness these transformations. It's, I don't think I'm doing anything. It's really Chinese medicine providing a real vehicle, almost like a flashlight for somebody to hold as they walk through that dark night of the soul to go through that transformational process. So today I have lots of different pictures of patients' transformations. As we go through today, if you have any questions, please feel free to ask. I have allotted about 10 minutes at the end of each section for questions, but I'd like to start with a picture worth 1,000 words, right? Of a patient's transformation. This is a patient I treated a few years ago, and she came in after suffering a pretty significant emotional trauma. Her partner had had a major seizure, a grand mal seizure in the middle of the night, and she found her partner having the seizure. She went and got medical attention. They got her to the hospital, got her medication. She was fine. But what this brought up for her, it triggered an old emotional trauma. When she was a child of 9 years old, she found her father having an emergency. She went to get help. When she came back, her father had passed away. So it was a significant trauma. And so what I find is a lot of even recent traumas will trigger past trauma. So she came in and she was feeling very distraught, very anxious, very scared, a lot of crying. So working with Chinese medicine to help her first feel safe and settled. And we'll talk about this more in detail, but to help her feel just that self-love, that centering, that grounding. So started with that for treatments for her, and she started feeling a lot better. She started feeling more in her adult self. She could begin processing that emotional trauma. Because essentially what happens is people have these traumas and they just kind of push them away. And that's kind of what had happened with that trauma she had when she was 9 years old. So then move forward to the next stage of treatment to help her feel even more settled and soothe those trauma memories that were coming up and start addressing some of the individual imbalances going on for her. And then just a few weeks later, she started feeling much better. What I thought was so amazing, this woman literally got taller with the treatment, which I was totally surprised at. And there's some treatments we'll talk about using the Du channel, the governing vessel, that really helps to lift their spirits and lift that energy. So that's just an example of the idea of going through and processing emotional trauma. And so today we're going to go through and talk about what is an emotional trauma, what are the causes of emotional trauma, what are the different physiological effects on the body from emotional trauma, and then looking at the different treatment approaches. I found a kind of a three-staged approach that works very well, and then talk about some case studies. Now this picture here on the screen is of a mountain, and I learned this from my teacher, Dr. Wei Che Young, and he said every time you're learning something new, it's like going through a mountain. So when I was writing my book, I wanted to put this example in the book, but my editors were like, what is this going through a mountain? What the heck are you talking about, CT? So I didn't put it in there. I just put, walking through a forest or going over a mountain, but since you guys are here, I can explain it more in detail. So going through a mountain is the idea you're going up to a mountain. You can see, the front of the mountain, but you can't see around the whole mountain. It's not until you go through that mountain, go through that dark night of the soul, you come out the other side, you can see all the way around the mountain. And that's what I see happening for patients is when they finally are able to feel settled and start working through and processing their trauma, they can then move forward, go through it, and then see the whole picture and get that full perspective to be able to move forward. So I have a lot of pictures of patients' cases. This is kind of a crazy slide, but it's really, I would ask no pictures if you could of the case studies of the pictures. I have loaded all these slides onto the portal for you guys to have access to, but I would say for those, if you could just not do that. So emotional trauma originates from the word wound. And wound, I think it was Rumi that said, wound is where the light shines in. So of course it disturbs your physical body, your emotional body. But what I find really happening is if you can go through and process that trauma, it is like a metamorphic process. That's why I put this picture of a butterfly here, because I've seen people transform just like that woman you saw initially, go through and then literally be able to move forward and shine in their full essence, shine in their full ability to bring their spirit to the world and fulfill their spirit destiny, in a sense. So the cause of emotional trauma, it can be many things. It could be birth trauma. It could be divorce, loss of a loved one, childhood trauma, natural disaster, getting a medical diagnosis. What I think is interesting is emotional trauma is not just an experience. It can also be something that you've heard about, something that you've witnessed or seen a picture of. So this is pretty significant, especially now with all of us having smartphones in our hands, right? And we can see all these different videos of everything's happening. I've recently treated some people who were traumatized. I don't know if you guys heard about this. It happened in the state of Hawaii about 6 months ago. There was a fake text that went out that basically said, the bombs are coming, run for cover, get your family. And some patients of mine were traumatized by that. Now, they were not in Hawaii. They don't have any friends in Hawaii. But just by hearing about that, they were traumatized. So I think that's really a significant issue that can not just be something you've personally experienced, but it can be something that you've heard about. And besides that, there's also inherited trauma. You guys might have heard of this. There's been a lot of studies recently of looking at the non-coded DNA and seeing that people whose ancestry had trauma, they're experiencing that same type of trauma. So this came out with a study with Holocaust survivors' children. These were children of Holocaust survivors, and these children had, grown kind of like normal lifestyle, but they were experiencing similar symptoms to their parents. And so we can see this inherited trauma being an issue as well. So there's really a few different causes and different things that can really play a role in contributing to trauma. And now it's amazing. In Western medicine, they're seeing that, there are many causes of emotional trauma that can create physiological imbalances. So if the trauma goes unprocessed, you get PTSD. You guys have heard of PTSD, post-traumatic stress disorder. This was first given a diagnosis in the 1980s for combat veterans. So people who had experienced, combat, had come back from war and were having flashbacks. Well, now Western medicine and, of course, Chinese medicine recognizes that it can be any of these traumas that will still cycle through, that will charge the emotional body, charge the physical body, and put the body into a state of fight or flight, essentially. And it doesn't, until it's processed, people are still triggering. It can be a sight, something they're seeing, something they're hearing, something they're smelling. It can trigger that PTSD. So the way I look at emotional trauma in Chinese medicine, I broke it into kind of 3 stages of the physiology. There's a traumatic event or something you heard. The inherited trauma is lit up in your non-coded DNA. So that's the initial. And then the trauma gets relived. You keep remembering, going back, having these flashbacks of the trauma, and it's charging your emotional body and physical body. And then it can stay unresolved and remain in the tissue for years. People come in, they've had trauma 20 years ago, it's still triggering them as if it's happening right now, and it's upsetting their physiological imbalances. So in terms of Chinese medicine, if we look at the 3 treasures, Jing, Qi, and Shen, I really like thinking about the 3 treasures and how are they affected. And so starting with Jing, your essence, your physical form. So this is something that you've been passed down through the lineage, through your parents, through your ancestry. And Jing isn't something you're just given all at birth. It's slowly doled out year by year. And if you have an emotional trauma, it can freeze the jing at that time. It could disturb the jing. It can disrupt the jing. So, for example, in face reading, we look at the facial map for the ages, and we can see different lines at different ages when people had a compromise of their jing. And so when we find that compromised area, we can think, oh, there was a trauma at this time in their life. Their jing was affected at that point. So it does disrupt that. But there's ways we can do to help to unlock that jing, get that full potential back again through Chinese medicine. Now with the qi, what happens, it becomes scattered. Somebody gets shocked, their qi wants to go in all directions. So it gets scattered, disordered, and then over time there's blockages, and then you end up with depletion of that qi. And we'll talk more in detail about that too. Then there's Shen, and there's a lot of discussion about what is Shen even mean? When I look at Shen, I think of Shen as being the light that's reflecting and refracting through a crystal, creates this rainbow of colors. And I believe we each have our own rainbow of colors in our body. When we experience emotional trauma, the Shen gets scared. It wants to be, content and held in the body. When you have that shock, the Shen wants to leave the body. This is the whole idea of unrooted Shen. And it becomes disturbed. So looking again at some more pictures here, this is a woman who came in who had a lot of significant trauma as a young girl, especially around her sister's death. When she was 14, her sister passed away, and it had haunted her ever since. Every time there was the anniversary of her sister's death, her sister's birthday, it would bring all these memories back, and she would feel stuck and trapped and not able to move forward. So we'll talk more about what we can see when we look at faces in terms of the Shen. But for her, she was feeling really locked and unable to move forward and really scared to move forward and scared to engage in life. We can see her eyelids here, just a quick little note for facial diagnosis. The eyelids are like the pericardium. And when the body is feeling safe, the pericardium's open, it's receiving that emotional energy. When there's a bit of unsafety, the pericardium wants to close down. So she's having a little bit of this kind of shut down feeling, not wanting to move forward. So we started doing acupuncture for her and some other Chinese medical treatments, and she started feeling better. She started feeling like she could start engaging with life and not feeling so held back by her sister's death. And so she started feeling better, more open. And you can see also this laser pointer isn't 100% great, but looking at her eyes here, how the color of her eyes got even brighter, the Shen coming back into her spirit. And she started saying that she could feel less triggered by her sister's death. And in fact, this picture was taken right around the anniversary of her sister's death. And she was able to still go to work. Typically, she wouldn't be able to go to work. She'd be crying. She would just not want to go out and engage. Continued with treatment, working on soothing that charge of that memory, also working with trying to balance her individual organ systems and channels, and she started feeling much better. And by this time, she had decided that she could go back to graduate school and move forward on her path. So what's really interesting is going from that scattered energy to feeling more centered, able to process, and then moving forward into life. So the different stages in the body, we're looking at the traumatic event, we're looking at reliving the trauma memory, and then the individual imbalances. And what I want to talk about is, one at a time, we'll look at these different stages and all the different physiological aspects that are involved. So, like I said, when you experience that trauma, the energy wants to go everywhere. It gets scattered. So there's chaos in the body. Now, the earth element is all about regulation, routine, having that rhythm in the body. Well, the earth element gets disturbed, it gets scattered, so it goes in all sorts of directions. So there's a stress on the earth element. Like I said before, the spirit wants to leave the body, it gets unrooted, it wants to move and run away, essentially. It wants to get away from that traumatic event, that shock. Now, another organ that's involved is the pericardium. The pericardium, as we know, is the heart protector. It's what regulates the heat in and out of the heart. It also regulates the blood flow to the heart, and also the emotions coming and going into the heart. If you have that trauma, there's that tightening. The pericardium wants to protect the heart and not let that emotional energy in, which is a great survival mechanism, but if it doesn't get resolved and that trauma stays in the body, the pericardium remains tight, and then the heart is not having that interaction with the emotions, and there's that shutdown feeling. So we have to work with the pericardium and help to regulate that again. And then finally, with the blockages in the channels, because the chi is in chaos, it's scattered, the chi is no longer flowing and moving through the channels properly, you get blockages that can create heat, cold, phlegm, damp, all these different conditions, and this is all about that chaos in the body. These pictures here, I really was thankful. Kirsten Wright did this one here on the right here. We're trying to find a way to depict that idea of that scattered energy and that energy going every which way but loose. And this is, I think, a really good way to see that, like just complete chaos when you experience that traumatic event. And then the blockages, this was done by my youngest son, actually. I thought this was a great depiction of the blockage in the channels and that communication being down. So the idea of like the city being an organ system and that blockage there, and there's not the communication in the channel pathways. So then if that trauma isn't processed, I mean, the thing is, we experience traumas on almost, we all experience some kind of trauma. Everybody feels them differently. Some people experience a trauma, they process it, move on, it's a thing of the past. But for a lot of traumas, they're significant enough where they become trapped, and then they cycle through. And so what happens is you get that reliving of that traumatic event, that traumatic, either the inherited traumas coming up, or there is that event or that memory or some vision that you saw, it's coming back. And so you get that charged energy, that is creating heat. It's that intensity, that emotion. We know emotions are like winds in Chinese medicine. So the idea of when you get that charged emotion, it's creating more wind in the body, and it's also creating this heat. There's a great image of the heart as being a reflecting pool. I don't know if you guys have heard this before, but the heart being a still mirror, like a reflecting pool. And if your the emotions are calm, the water is still, it accurately reflects what's going on around you. But if you get an emotion that comes in the body that's really charged, it creates this wind. And then that wind goes across that still reflecting pool and disturbs the water, and you can't see as clearly around. So the idea is when you have that reliving of the memory, it's disturbing the heart, it's creating that heat, that wind in the body, and you can get rebellious chi. I had one patient I was treating who had been in a severe car accident 5 years before coming in for treatment, and she was coming in the clinic and had complained about hiccups. I said, okay, we'll treat your hiccups, but I started asking her history and realized she was in a severe car accident, had a traumatic brain injury, many surgeries. And I said, well, we can address your hiccups, but let's first deal with this major event that happened for you. And what I've noticed is when you look at the bigger picture and work with that scattering of energy and helping them to get settled and soothing these trauma memories, then you work on the more global picture and these individual symptoms will resolve. So it's tempting. Somebody comes in after a car accident, they say they have whiplash. You want to do these points for whiplash. But what I found clinically is until you get their whole energy settled and gathered, those points aren't going to work that great. The channels aren't responding, just like I showed in that last slide, the blockages in the channels. Until you get the channel communication back, you can do the best points for whiplash in the world, but they're not going to really respond until you get things settled. And you get this trauma memory to be soothed. So then once you've got these bigger pictures taken care of, then you can move forward to dealing with the stored trauma in the body and how it's creating specific individual imbalances for that person. We can get a whole host of excess conditions. You can get heat, cold, chi stagnation, blood stagnation, phlegm, damp. But over time, as we know in Chinese medicine, with those excess conditions, they're going to lead to deficiency. They're going to lead to either yin deficiency or yang deficiency or qi or blood deficiency. And so you're going to get a whole host of combinations for people, and that's where we really start doing the differentiation and working specifically with individual channels, individual organ systems. So that's that's the overall picture of how we look at the stages of trauma here, because what can happen is people will come in with a whole variety of symptoms. You know, all sorts of emotions. They can feel fear, they can feel anger, they can feel anxiety, all these different emotions. There can be a lot of behavioral issues too. Avoidance, like I said, for that one woman who was being triggered by her sister's death, she didn't want to go out. She did not want to go out to work and engage. I have another picture I'll show in a moment of a woman who I treated, who she was in her 20s, and she had experienced a lot of emotional trauma as a child, and she got to the point where she couldn't even leave the house. She couldn't even go to the grocery store, and she was literally stuck in that energy. So avoidance is a big one. People just want to shut out. Like I said, with that pericardium, the eyelids closing down, that's how the energy is for their whole entire being. They don't want to engage. There can also be self-destructive actions. This can be like the cutting. I have one patient I'm treating right now. He is having issues with self-destruction in terms of hitting his head against the wall. Every time he'll have that relived trauma memory, he'll want to hit his head against the wall. Well, through acupuncture and through treatment, we've actually been able to be successful with him. He's no longer doing that. He'll sometimes slap his head every once in a while, but that's becoming even more infrequent too. So you can get a lot of this kind of issue with the behavioral piece. And then physical, we know this. We've heard about people who have insomnia. They can't sleep after a certain emotional trauma. They have fatigue, poor concentration. A lot of times it's a dead giveaway. Is emotional trauma affected? We've all experienced probably some emotional trauma in our life. Is it disturbing our physiology? That's the big question. Because not all emotional trauma is the root of all evil, right? It's not all the physical symptoms or emotional symptoms are caused by emotional trauma, but there's things we can do to look and differentiate. Is emotional trauma still active? Is it still triggering the body? Is it still affecting the physiology? I mean, it's pretty obvious if somebody comes in and says, I've had insomnia ever since I was in this car accident, or, you know, I've had poor concentration ever since my mother died. That's kind of obvious. That's a real easy clue. But we have to look more subtly because it's not always as easy as that. So we're going to look at the different diagnostic methods. Now, in my clinic, I use several diagnostic methods. I use facial diagnosis, I use channel palpation, pulse diagnosis, and tongue diagnosis. I also look at the spirits. I try to intuit what's going on with the spirit balances, looking at the jur or the shen, to see what's happening with that aspect of the body. So for example, somebody comes in and you're getting a sense that their boundaries aren't very clear. They're just not, just more of an intuiting sense. You might get an idea about their Po then. Their Po is not very strong. It's not holding that boundary for them, that container. So we want to help work with that. So this is a quote that Dr. Wang Ju Yi used a lot when he would lecture, and from the Nanjing about using multiple diagnostic methods. So the gist of the quote is essentially you want to use more than one diagnostic to be able to understand the true nature of what's going on with that pathology. And this specifically talks about pulse diagnosis, channel palpation, and looking at the color of the skin, facial diagnosis. So we're going to go through each one of these diagnostic tools and see what we're going to see in terms of the physiology changes from emotional trauma. Now, for facial diagnosis, I use the Lillian Bridges facial diagnostic lineage. For channel palpation, I use Dr. Wang Ju Yi. Anyone do channel palpation out there in the crowd? Great, well that's wonderful. Dr. Wang would love to hear that, because when I started studying back in the 90s, people weren't really doing channel palpation. Now it's much more known, and we'll talk about some very basic things that you can feel, even if you don't do channel palpation in your clinic, some of the major changes you can find. I use the Dr. Shen Leon Hammer pulse diagnostic method. We'll talk a little bit about that, and then some general tongue ideas. So like I said, with that first stage, it's scattering the qi, it's disrupting the homeostasis. So the body's always striving for that homeostasis. When you get that scattered energy, it's hard to maintain that. The body kind of clunkily gets back into the homeostasis, but it's still not able to get back into that rhythm. And the pericardium's tightened. So how are we seeing this on the face? So beginning with facial diagnosis, this is that first slide I showed you with the patient who had had the trauma, waking up in the middle of the night, seeing her partner having a seizure. remembering about her dad. You can see the Shen here. So we're looking for, how is the Shen, how is that light animating the body? How is it coming through the eyes? How is it coming through the skin? So we can see her eyes there. There's kind of that muddy, kind of unclear eyes, and that vacant, confused look with the eyes. You guys can probably see that. She's here in the room for the picture, but she's not really here. You can see how the spirit has left the body. Sometimes you can have a paleness to the skin, but in her case, it's more of a muddiness. The light is not shining out through her skin. And in her case, too, I could sense this kind of vacancy, disconnect, not really being present. Also, she came in and she was very hunched over. You can kind of see in the picture, but she's very hunched over, almost going back to that 9-year-old state where she wasn't really in her full energy, opening to that spirit. So these are some pretty basic things that we can look at. And so just looking at other ideas of scattered Shen, other examples, here's a man who came in whose wife had just passed away. And you can see in his eyes that cloudiness to his eyes, that sadness in his eyes, a very intense scenario, which I'll talk about later. I'll show pictures of him after the break. But you can see that kind of that dullness to the skin. His face is also falling. Can you guys see that? Like just that, his mouth's open, like, and this kind of thing, just his spirit is just leaving. This was 2 weeks after his wife had died, and very intense, very almost like a lost type feeling. Another example is this woman here. She had a lot of trauma when she was a girl and through her 20s in relationships. Do you guys notice her eyes? They're trying to look at the camera, but they're not looking at the camera. So there's this, her eyes are going in two different directions. The spirit, of course, is animating those eyes, and if it's left, there can be this disconnect, and there's just not that focus. She also has that their eyelids wanting to close a little bit too. You can see more of, in this case, more of a paleness to the skin, just that the spirit's not really warming or opening to the skin. This other woman here, she had a lot of traumas, especially in her 20s. I had mentioned that idea of different horizontal lines we can see on the face that relate to when the Jing might have been compromised. Now, we think it's good in facial diagnosis to have some lines on your forehead because it means you've had some lessons in life. It's good to go through those lessons in your 20s because you have all that strong chi rather than having to wait till later in your life. But in her case, they were very defined, and not only were these lines defined, but there's an indentation on her forehead that relates a lot to the jur. So this area here, the forehead relates to the kidneys, to the essence, and when that's compromised, there can be an indentation actually on the forehead. So this is a sign a lot of suicide. You look at a lot of people who've committed suicide, you look at their picture beforehand, you can a lot of times see this indentation. I'm not talking about the lines here. The lines are normal. That's a pretty normal sign. It's an indentation. I'll show you her picture in a few minutes here, the transformation and how that forehead changed. But that was another sign of the spirit not animating. The spirit's literally getting sucked out of the body, so to speak. So it's right through here, almost like a hand is pressing on her forehead. You know, like people when they have that, I do a lot of, I think a lot about how people touch their face, like body language, and so I study that a lot. People do this a lot. Have you guys seen this? Like, it's like the despair. They're literally just like holding their head there. So a lot of times we'll see indentation in the temples. This can be an issue with needing to connect with spirit and having a propensity for spiritual growth or enlightenment or wanting to experiment with drugs. So hopefully it's the first, working with the spirit. But then when it goes further into the forehead, that's really when the spirit has started to be less strong. There's a weaker jur. Does that make sense what I'm saying with that indentation? Yeah. So just a couple other pictures here of scattered Shen. This one who came in and she was just feeling just not engaged in life. And for her, what I get a sense of is almost like a wall of energy in her eyes. She's this kind of a, lights on no one's home kind of situation. She's there, but she's not there. There's that paleness, almost a frozen. Another aspect of her face is her nose tip. I don't know if you guys can see this, but it's like pinched, almost like she has a clothespin on the tip of her nose. This relates to the heart, and it's a pinching of the heart. So it's that pericardium being tight there. But again, that kind of pale frozenness. The last picture here is a gentleman who came in who's had a lot of trauma as a kid and was diagnosed with complex PTSD and had been through a lot of therapy. Now his eyes, I see Shen coming through his eyes here. But you'll see the transformation. It becomes even more, even stronger Shen. So he had already done a lot of work, a lot of therapy, but was still feeling a lot of issues with disconnection, poor communication, and just still feeling scared and held back, still having that avoidance issue. So now in terms of channel palpation, for the channels, you guys can do this too. There's three main channels I look at that I think are involved in emotional trauma. The first one being the Sanjiao. The Sanjiao, or triple heater, triple warmer channel. The Sanjiao represents the infrastructure of all the channels. It's the interstitium. You know, Western medicine recently discovered a new organ called the interstitium. That's the fascial planes of the body. We've known that in Chinese medicine for, millennia, and the Sanjiao really reflects the health of that channel infrastructure. So when you're palpating along the Sanjiao channel, you guys can try this too. It's mainly between your wrist and your elbow, and you're using this kind of third aspect of your thumb, this third here, the inner third, and you're pressing along. And what we're looking for in the Sanjiao channel are little bumps like sand, little kind of bumps along the road of the Sanjiao. And this can reflect the health of all the channels. Now, if you feel several bumps here, you might realize the Sanjiao is affected, and this can give you a hint into there could be chaos throughout all the channels. Now, it's not to say that every time you have a nodule in the Sanjiao, there's chaos in all your channels, but this gives you yet another hint at what could be going on in the bigger picture. Another channel I look at, of course, is the pericardium. I just talked about the pericardium tightening and having that blockage there. So when you look along the pericardium and feel along there, you might feel tightness. And this is very common in emotional trauma. Now, a point that I find that's typically affected is pericardium 4. Anybody have an idea why pericardium 4 might be affected? Pardon? Yeah, it's a Xi cleft point. And so this is a Xi cleft point. Xi clefts is like when you're going along the channel, like on a river, come to that narrowest part of the gorge. So if there's blockage and tightness in that channel, it's very common there's going to be tightness in the Xi clefts, pericardium 4. So what's interesting about the pericardium channel with acupuncture, it responds very quickly to treatment actually, and Dr. Wong confirmed this too, that the pericardium is very easily affected by Chinese medicine and by acupuncture. So a lot of times these nodules that can be pretty significant can resolve in a week or two. It's pretty amazing. Now the lung channel is another channel I look at as well because the lung is the most outermost zong organ, and so it's going to be the first affected by pathology, pathogen, by that emotional trauma, those winds. So same thing when you're feeling along the lung channel. All these I typically am finding between the wrist and the elbow, and some tightness along the lung channel, and again that nodule at lung 6. This is a common finding as well. Now, interestingly enough, with lung 6, it can be also a trauma memory or even just a memory of a pathogen that got lodged in the lung years ago, like pneumonia. So you have to differentiate this. But this gives you hints, again, at what's happening in terms of if there was a trauma that affected the channels. In terms of pulse diagnosis, we're looking at many things. These are just some of a whole host of different qualities you might feel at the pulse. No one's going to come in with every single one of these, but this is going to give you an idea of how the physiology is affected. So scattered pulse, that's kind of obvious, right? The scattered energy. There can also be a muffled quality to the pulse. This is like as if a blanket has been over the pulse. So you're trying to feel it, you can't quite feel the spirit of the pulse. It's not enlivened, it's not there. There can also be a smooth or rough vibration. This is really talking about the charge of the body, that kind of fight or flight. Kind of it's ramped up, so to speak. And so you can feel that vibration. There can be tightness in the distal position of the heart. So these are pretty common. This is all from the Shenhammer pulse diagnostic lineage, but some of these would definitely translate into other pulse systems as well. With the tongue, that's a little more difficult to see that initial emotional trauma. You might have a little bit of duskiness from the blood stagnation, a little bit of paleness, but otherwise it can be normal. But the tongue is, of course, very helpful to see how the body's been affected by that emotional trauma. That woman I told you about earlier in her 20s who just couldn't leave the house, couldn't go to the store, couldn't do anything, she was affected a lot by dampness, being held back, being stuck. And so here's her tongue. You guys can see there's a lot of thick coating, yellow, a little bit white. The redness around here, some duskiness, the prickles. So she was having this pretty intense dampness and heat and blood stagnation. She literally couldn't move. She couldn't move forward. She couldn't go out into life. Through treatments of helping with getting her centered and gathered, helping to soothe those trauma memories, she, in just a couple weeks, she really had transformed. And this one was amazing because she started feeling like she could do things. She went to the store. She was able to go over to friends' houses. She was able to go out of town on vacation. And she started getting this inspiration to start a sewing business. And it's not anything that I'm necessarily doing. It's just Chinese medicine helping to open her spirit to be able to get back and engage again. And so you can see physically these changes too. Now, of course, with the body we talked about, there can be a whole host of emotional or physical issues. One thing that I've noticed a lot is fatigue, poor concentration. This woman here her emotional trauma was basically being suffered from serious medical diagnosis. And so we'll talk about her case later. In a few minutes, I'll show her transformation. But she was feeling that poor concentration, foggy headedness ever since she had that diagnosis. Of course, there can be a whole host of these different things in the mix. So then someone's reliving the trauma memory. After it's been lodged in the body, it's coming back. They're getting that heat. They're getting that wind. They're getting that charge. So how does that relate in terms of Western medicine? This is really from the research of Dr. Bessel van der Kolk. He's a MD in the United States who has a trauma clinic in Boston. You guys might have heard of him. He talks about really three aspects of the brain being involved in emotional trauma. There's the prefrontal cortex, the limbic system, and the brainstem. And so these all are playing a role in when someone's reliving a trauma memory. Someone has this memory, it's charging their emotions. So the limbic system is in charge of the emotional body, and it gets charged, it gets activated. So somebody's limbic system gets charged. In an ideal world, the prefrontal cortex is your logical brain. It's what develops from ages 0 to 7. It is what's supposed to tell the body where you are in time and space, what the present moment is. So when that limbic system gets charged, the prefrontal cortex should say, no, wait a second, this isn't 20 years ago, this is right now, settle down. The limbic system calms down, fine, done. But that's not the case. When the trauma's been stored in the body and it hasn't been processed, that limbic system gets charged, the prefrontal cortex is not communicating. It sends signals to the brainstem, which floods the body with neurochemicals, and the body goes into fight or flight. You guys know about this idea with PTSD. People are charged up, they're scared, and they're darting around, this kind of thing. Well, over time, that fight or flight can only last for so long. Then the body just starts to shut down, and that's when you get, chronic pain, and all these systems that have been charged for so long, they're shutting down. So we can see in terms of some of the things on the face, we can see heat. We can literally see that heat, that flushing. When someone comes in, they've been recently charged. We can see their eyes darting around, that intensity with their eyes. And then over time, it will start to become more clouded and dulled. Of course, the pulsar is going to be that charge, so it can become rapid. It can become tight. With the tongue, you might see extra heat on the tongue. With the channels, you might notice things, especially around heart 7 and pericardium 7. You can feel little nodules there and tightness. That's that heat charging in the body. It's disturbing that heart mirror, and there's no longer that stillness. So a couple examples of people who had a recent charge when they came into the clinic. This woman here had been suffering from trigeminal neuralgia. She had gotten better through acupuncture, but then had a flash of pain. it brought her whole host of memory of dealing with that pathology back. And so she had heat in her face. You could see heat on the cheeks, heat in the chin. This chin area relates again to the kidneys. So we have the forehead relating to the kidneys, but so does the chin. And so if there's heat there, there can be heat disturbing the kidneys and fear. So she's having this charge. Her eyes are in that clouded, kind of lacking the Shen type of aspect. Because she'd been through so much, it's kind of going straight to shut down. This other woman here, her trauma was she was walking to work one day and got hit by a car when she was crossing the street. It was a miracle she could actually walk away from that. And she was coming in for acupuncture for treatment. But on her way into the clinic one day, she was almost hit again by a car. So of course it charged her whole trauma memory of that incident. So with her, you can see the intensity in her eyes. You can see a little bit of the heat in the cheeks, in the chin area, and just that almost shock, charged look, because it's been, that trauma memory has been triggered and it's been activated again. So then if it becomes lodged in the body, we end up with these conditions of excess and deficiency. And where we're at now is between working with the energy between heaven and earth, helping to reestablish that flow in the vessel, helping to work with the different channel systems that have been involved and the organs that are involved. And that's where we really go into the detail diagnostic workup. I don't have time this morning to go into all of that detail. We're going to talk about the first kind of ideas of working globally, but there's a lot that can be done with Chinese medicine in terms of differentiating the different physical, behavioral, and emotional symptoms that people will have. And you can look at the different aspects on the face, on the pulse, on the tongue, on the channels. And that's something I think is very important. It's a huge gift we have with Chinese medicine to be able to differentiate that. But looking at some transformation pictures here, here is that woman who I showed earlier with that indentation on the forehead. A little background on her. She had had a lot of issues in her 20s, which we can see. There's these lines, these age marker lines for the 20s. So the forehead represents the 20s. And so her Jing had had a lot of disruption, freezing. And what her background was is that she tried to commit suicide in her 20s. She found religion and realized that wasn't the way to go. So at this point now, she's in her 40s, and she is still not engaged in life. She hasn't found what's going to animate her, what's going to bring her back to her full spirit. So she was just kind of existing and being frozen. You can see again that checked out look. There's some other lines here too that we can look at in terms of emotions. So these lines off the corners here of the cheeks and also in the cheek area here, those relate to the lung. So these off the outer canthus, this relates to grief. And so there's been a lot of grief for her. And the lines in here in the cheeks, this relates to the Wei Qi. She's been so stressed. She doesn't have that extra energy, that extra fullness to protect. So we know there's an issue with the lungs going on here too. There's also lines around her mouth that represents the earth element. So there's a lot we need to work on, but first helping to center her, helping to get her feeling loved and held. And then she can start moving forward and processing, working with calming down those charged memories, and then working on the individual organ systems. So through all that process, I did that, and also just encouraged her along the way to try to find what she loved. What is something that's interesting for her? What does she really want to do with her life? And then she transformed to this. Yeah, so it was awesome. Now, this was over 6 months, so it took some time. It wasn't instant. But what the most significant thing, well, I mean, there's a few things, but her forehead, you can see it's no longer indented. Now, she's smiling, so she's still lifting her face, but it's not that indentation there. And she talked about this too. You know, over time, we were trying to figure out what is something that you're interested in. She was really interested in health and learning about nutrition and trying to help teach others, and that's what she started to engage with. Now, I thought another interesting thing is her eyes. You guys see her eye color change? It's kind of crazy. I was talking to Johan earlier about this. I take pictures of my clinic, and a lot of times Because I've just been seeing them, I don't really notice the huge differences until I put the pictures together and I can really see that shift and that transformation. Now, she still has some lines on her forehead, which is fine. That's about the 20s and going through those, dark nights of the soul, so to speak. But now she has the will to live. Her will is stronger. There's less lines in her cheeks. And her skin you can see the spirit coming out. You guys can see that spirit. So that's what we're trying to go for, to help someone really work through that transformation. Here's that woman I was showing earlier where her eyes aren't looking at the screen, aren't looking at the camera. We want to help her to feel safe. We want to help her to feel grounded so she can then move forward and process all those old traumas, not shut them away, not close down. And so did treatments in that direction. She started feeling better. She started being able to look more clearly. Her spirit was back in her body. And she was definitely more open. And you can see the color under her skin too. So she was making this transformation and then working more at the individual imbalances. And then she improved a lot as well. She started feeling a lot more clear. And this was taken several years ago. And I've seen this woman again recently since. And she's still doing well. So that's kind of the things we're trying to help people so they can move forward and then just go on down the path to more of their opening of the spirit. And you can obviously see her eyes are more clear and looking at the camera. One last picture here is a woman who was given a diagnosis. She had had atrial fibrillations for several years. She'd been on medication, but they weren't getting better. They were getting up to 220, and so it was very intense for her. But she got to the point where the doctor said, you know what, your heart is so weak you can no longer take medication. Your heart is not strong enough. And so the doctor said, there's nothing else we can do, because if they continue with medication, she would have got worse. So she had to stop medication. And the doctor said, there's nothing we can do. Try to make peace. That's it. Well, she's pretty stubborn. She's like, no way. I'm not giving up. I'm going to try something else. So she came in for acupuncture. I'm sorry?
I think she should see another cardiologist.
Another cardiologist. And it just is what it was. That was the situation. So I said, well, let's try Chinese medicine. We'll see if that can help. So worked with her to help her get centered first. And we'll talk about this after the break. The treatment approaches and the methods something just I encourage you guys to try. Helped her to get centered first, and then worked with that charge, that memory, because she would get that, that charge, that heat, heart rate would go up, this kind of thing, and then work with the channels. Now, interestingly enough, Dr. Wong differentiates the pericardium from the heart channel. If you guys are working with the heart in terms of the blood flow to the heart versus electroconductivity, for the blood flow, that's more regulated by the pericardium channel. That's what Dr. Wong had found. For electroconductivity, that would be more the heart channel. So at first, I worked with their pericardium to work with that tightening, then moved towards the Xiaoyan channel. So for her, going through several treatments, she really improved. She got a lot better. And she's an amazing woman. She has so many great stories and such a great spirit. You can obviously hear spirit enlivened. But also her nose tip. The nose tip reflects the heart. So you can see in this picture, it's a little washed out, but it's very red, dusky, lines, indentations there. The heart had a lot of blood stagnation. There was even some blood deficiency too, and just weakness in the heart. Well, her nose tip definitely improved and was better. Yes?
You said she had atrial fibrillation. Was she getting atrial fibrillation from the trauma memory?
She had atrial fibrillations before, but then when she got that diagnosis, it didn't help. It definitely charged that up for her. So she started feeling better. Now, what was awesome is she was feeling better. She went back into her cardiologist, and the cardiologist said, oh, your heart's stronger. We can put you on medication. Your heart's strong enough for pacemaker surgery. So she was able to get pacemaker surgery, go back on medication, and really thrive. So it was kind of the best of both worlds. And I really find that, with Chinese medicine, I think it's great where there's this integrated approach and, these, working together. So this is really, again, that idea of helping her to get back into her spirit, back into her full energy. So like we talked about the traumatic event, how that affects the physiology, what are the diagnostic signs, the charged memory where you're getting that heat, the wind rising up, and then, the unresolved trauma that's causing this excess and deficient signs. So, okay, great. This is all great, CT. Now what do we do? So what we're going to talk about after the break are the 3 different stages that I found effective. And the first stage is what I call gathering the chi, helping someone to feel centered and grounded. The second stage is soothing that trauma memory. So the body isn't going into that fight or flight stage. It isn't getting into that point where it's so exhausted and can no longer interact. So it's working with those memories. And then the third stage is really working with those individual imbalances. So that's what we're going to talk about after the break. We have a few minutes. Does anybody have any questions so far in terms of the physiology, the diagnosis, any of the signs, any of these kind of things so far? Yes.
I'm interested to know if you treat people with severe mental health problems. For example, it might be bipolar, schizophrenia, or bipolar disorder, like borderline personality disorder, things like that. And how much you see that as being stacked up over a period of time from the initial trauma, and how the system is sort of backlogged in a way, and then how you would approach using this method for those kinds of conditions.
Yeah, thank you. So his question is really, do I treat severe mental illness like borderline personality disorder or schizophrenia or bipolar? The answer is yes, I do treat that. And it's not necessarily the exact same approach, but sometimes it will, in terms of they've had traumas that have triggered these to come to the surface and become more enhanced. That can be something that will be in the mix. So I have to first decide, is there a trauma involved? Is there something that's really cycling? And if that is the case based on those diagnostics, then I will start moving into this staged approach. But otherwise, I would look to see, okay, if there really isn't trauma in the mix here, it's not necessarily contributing significantly to what's going on for them, then I will work more differentiation-wise and this kind of thing. Yeah, so thank you. Yes?
I wonder whether you, or what you think of the concept of possession. Those, for me, is absolutely amazing pictures. How does that link?
I think it's a great question. I think one of the most clearest examples is that woman when she's not looking at the camera. So I do think about that. I do work shamanically, and I do think about helping again to get their spirit back in the body and clear any spirits that could be potentially in the mix that are affecting that person's energetic. And this is something that I have seen, as you can see those pictures, it does clear. And I'll talk after the break about certain methods I do, especially with drumming. I'll do some demonstration with drumming, how that really helps. But even these treatments with acupuncture and herbs can also help with that as well. Because what happens is, spirit leaves the body. Well, now there's an open vessel. So guess what? Some other entity might come in. There can be other energetics that happen for that person that are now kind of taken over, so to speak. And so one of the most common signs when you can see possession that I understand from my teachers is that where the eyes aren't looking in the same direction. So you see this kind of disconnect there. And I have seen, through doing these treatment approaches, that helping to clear. Does that help to answer?
Thank you. Very interesting. I had it originally in 5-element background.
Mm-hmm.
What I'm interested in, one thing I'm interested in, is the levels of internal resonance in your work. So when you talked about pre-cerebral frontal cortex, about
Mm-hmm.
control, I had some hearing that was a necessary place to be. Whereas I'm interested in the level in which that actually we are in at some deep somatic seas and oceans of energy level. So something which is as practitioners, we relate to. Sometimes people are born with this talent, sometimes it comes through years of practice, but we have an instinctive feeling, intuitive level about treatment with the patient. And related to that are these ideas that the Shen is scattered and flies. So we have all our TCM stuff that we have to deal with. We have to deal with this very physical, symptomatic thing
Right.
before we can go
So his question, if I can try to remember all of it, is, but no, I know, it's about resonance, yeah.
Lots of stuff,
Right.
or very little.
Right. His question in a nutshell is when we're working with someone, working with resonating with that patient, is the approach doing a ton of stuff or just keeping it simple? I think it's a great question. He mentioned about the prefrontal cortex, that being important, trying to work with the depths of the energies swirling in us, the universal energy that's involved as well. This is all part of it. I look at all these aspects. I like to bring things together. That's why I wrote that book, to bring these different disparate diagnostic techniques together, to bring these different ideas of Western medicine and Chinese medicine, shamanism together. But his question is, the real question is, do I use a lot or a little? We're going to see after the break, I use very few points. I don't want to use a lot of points because we're trying to gather someone's energy. We're trying to help soothe their memory. If you put too much stimulation in, it's going to enhance that already charged sense. So we'll see these after the break. But I do use drumming. So another part of his question was about drumming and resonance. And I'll do some demonstration after the break with the drumming and how that helps for them to resonate with the Mother Earth, with Father Sky, to resonate with that universal energy, resonate within themselves, feel safe to come back in their spirit. Because if you come in and you're just, oh, I'm going to do everything, I want to do drumming, I want to do this, I want to do that, and it's really gung-ho, over the top, it's going to be too much. So it's definitely more of a gentle approach. And then if someone feels safe, you can start maybe incorporating more things. But as a general rule, anyways, from my teachers, we try to use as few points as possible and not overdo it. Does that help to answer a little bit? Yeah. So any more questions? Yeah. Mm-hmm. Yeah. Yeah, and so her question, you guys probably hear this, but about inherited trauma, and then also trauma that was maybe at birth, gestational, really early childhood. The answer is I do use these approaches for all of that. For talking about like the birth trauma or gestational trauma, that still would be in this kind of lifetime, so to speak. With the inherited trauma, this is trauma that's been passed down, that this person who's, like, say for me, I never experienced it, but my parents had this trauma. And so that trauma they experienced, but it was never processed, and it was literally passed down through the genes, through the jing, through the blood. And so that's another aspect that we can also work with. And that usually gets enhanced or activated under stress. And that brings that non-coded DNA to the forefront. And people feel these, oh, what's this? I'm feeling this anxiety, this scared feeling from this certain external trigger, but it has no relation to their lifetime. And then in terms of diagnosing early childhood trauma, there's a lot we can do looking at the ears. I don't have as much time today to talk about that, but I talk about that in my book, when you can look at the ears and see actually when someone was in the womb and see how that looks. And also, from ages 0 to 6 and then 7 to 12, you can see that as well. So, and just as a shameless little plug, on the lunch break, I will be at the Singing Dragon table doing book signings. And I've also, I'll talk about this after the break with drumming, but I've recorded a CD, and for the first 30 people who buy books, I have a free download card of that drumming CD. So on that note, we're going to take a little break, and then we'll be back in about 10 minutes. Thank you. Actually, about 20 minutes.